I want to talk about stem cell banking and the storage of cells for the future and the importance of these. As many of you know, stem cells have the capacity to repair, regenerate tissue, and become other cells. They're basically undifferentiated cells that have the capacity of cell renewal, so replicating again, and differentiation. These cells we have in our bodies, and we have a high amount when we're young, and as part of aging, and as a result of aging, these cells decrease in quantity and quality. Now, we have the capacity now to store these cells as young as possible. A lot of people have done it for their kids. What they do is basically you store the stem cells from the cord blood and the cord tissue when the baby is born, and you store these cells, if you freeze them in time, and you can use them in the future if that baby develops any condition that might be treated. Right now there's around 30 conditions, 30 diseases that can be treated, especially blood disorders, leukemias, and so on. And for adults, we're also doing a lot of research and advances in technology and treatments, including Parkinson's, Alzheimer's, other degenerative conditions, especially muscular-skeletal injuries, back pain, neck pain, joint injuries, and degeneration in general, like arthritis. So for these patients that, like me, that we didn't have the capacity or that possibility to store cells when we were young or babies, now we have the capacity and the possibility to store these cells. And it's more affordable than people think. It ranges between $250 and $300 a year to store these cells. There's an initial cost and fee to set up and to process these cells, but again, it's very affordable. And think about it, you're storing these cells that are going to help you in the future, so if anything, it's life insurance. So I encourage everybody to do it. And we're seeing a lot of advances, for example, in diabetes and Parkinson's and other degenerative conditions that we are going to be able to treat. Also, there's going to be technology available where we're going to be able to replicate organs or reproduce organs or make organs in a lab with these cells. And this is technology that is already being advanced, and it should be a reality within 10 years, I want to say. So this is the importance of stem cells. Now, how is the process of harvesting the stem cells? We usually use different sources depending on the patient and the conditions. The main source that we use for patients that are younger than 65 years old is using bone marrow aspirate. We go into the back of the hip bone. Patients are sedated. We numb the skin very well. It's a 10-minute procedure. It's fairly painless. Again, the patient walks in and out. It's an ambulatory procedure. The other source that we use is fat or lipoaspirate. We can get a lot of stem cells from fat. This is an abundant tissue. Everybody's willing to give it a lot of times, so it's easy to harvest. And again, it's not really painful. We can give the patient a little bit of sedation, and that's usually enough to do the procedure. It takes 20 minutes, patient goes home. And the last source that we use is blood, peripheral blood. So basically like giving a blood transfusion. We take that blood, we process it. This one has the least amount of stem cells, but it has some other cells that we can store. And ultimately, young cells are the key. Why? Because these cells have not been exposed to radiation, DNA damaging agents, and all these pollutants that we have that ultimately damage our DNA and cause diseases and also cause aging. So this is the importance, and this is the reasons why everybody should be storing their stem cells. If you guys have any questions or would like to get more information, please contact us and we'll be happy to give you more information. And hope to see you guys soon.